Are you a new mom worried about how to breastfeed your newborn for the first time? Welcome to the journey of motherhood, a journey filled with immense love, joy, and yes, a fair share of challenges. One of the earliest and most vital steps in this journey is breastfeeding. It's a unique bond between a mother and her newborn, a bond that nourishes, protects, and comforts. Breastfeeding is not just about nutrition, it's also about the connection, the warmth, and the love that flows from mother to child. However, it's completely natural to feel a bit anxious or uncertain about this process, especially for first-time parents. You might wonder how to hold your baby, when to feed, or even what if it hurts. These are all valid questions and concerns, but don't worry, you're not alone in this. We're here to help you navigate through these initial uncertainties. So take a deep breath, relax, and remember, you got this. Stay tuned as we guide you through this beautiful journey. Breastfeeding is a natural process, but it does require some understanding and practice. It's more than just a way to feed your newborn, it's a unique bond between mother and child. Starting off, let's talk about the benefits of breastfeeding for the baby. Breast milk is a nutritional powerhouse. It contains just the right balance of nutrients to help your baby grow and develop. It's also packed with disease-fighting substances that protect your baby from illness. Plus, breastfeeding can help your baby form a better emotional bond with you, providing comfort and security. Now, let's not forget the mothers. Breastfeeding helps the uterus return to its pre-pregnancy size and reduces post-delivery bleeding. It can also lower the risk of breast and ovarian cancers. Plus, it's a great way to burn calories. Yes, you heard that right. Breastfeeding can actually help you lose some of that pregnancy weight. There are, however, some common misconceptions about breastfeeding. Some people believe that it's supposed to hurt. While it's true that some discomfort can be expected, especially in the first few days, persistent pain is not normal and could indicate a problem, such as an improper latch. Another myth is that breastfeeding will cause your breasts to sag. Breast changes are a natural part of pregnancy and aging, and occur whether you breastfeed or not. One more misconception is that you can't breastfeed if you're sick. In most cases, it's perfectly safe to continue breastfeeding. Your body produces antibodies to fight off whatever is making you ill, and these antibodies get passed on to your baby through your breast milk, providing them extra protection. Lastly, some believe that a breastfeeding mother must maintain a perfect diet. While it's important for breastfeeding mothers to eat a balanced diet, occasional indulgences or lapses won't harm your baby. Remember, knowledge is power. The more you know, the more confident you'll feel. So let's continue to explore the wonderful world of breastfeeding together. Preparation is key when it comes to successful breastfeeding. Just like any other aspect of parenthood, breastfeeding requires some groundwork. One of the most important factors to consider is creating a comfortable environment for both you and your baby. This might mean finding a cozy chair with plenty of supportive pillows, or it could be a quiet, dimly lit room where you can relax. Comfort is essential as it helps to foster a calm and nurturing atmosphere, which is beneficial for both you and your baby. Next, let's talk about nutrition. Proper nutrition is vital for maintaining a healthy milk supply. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can help ensure you have the nutrients you need to produce healthy breast milk. Don't forget to include foods high in calcium and iron, as these are particularly important for nursing mothers. And let's not forget hydration. Breastfeeding can make you feel quite thirsty, so it's important to drink plenty of fluids throughout the day. Water, milk, and juice are all good choices. Try to keep a bottle or glass of water handy, especially while you're nursing, to stay hydrated. Clothing is another aspect to consider. A supportive nursing bra can provide comfort and ease during breastfeeding. Nursing bras are designed with flaps or panels that can be easily opened for feeding, making the process much simpler. Comfortable clothing can also make a difference. Loose-fitting tops can provide easy access for breastfeeding and can help you feel more relaxed. In conclusion, preparing for breastfeeding is all about creating an environment that works for you. It's about ensuring you're physically comfortable, well-nourished, and hydrated. And it's about having the right gear, like a good nursing bra and comfortable clothing. Being well-prepared can make a world of difference. So take the time to prepare for breastfeeding. It will not only make the process easier, but also enhance this beautiful bonding experience with your newborn. One of the key aspects of successful breastfeeding is achieving a good latch. Let's dive right into it. Imagine you're holding your baby in a cradle hold. You'll want to align your baby's nose with your nipple. This might seem counterintuitive, but bear with me. When your baby opens their mouth wide, You'll guide them onto your breast, nipple first, then the areola. Here's a tip. You can encourage your baby to open their mouth wide by gently stroking their upper lip with your nipple. It's a natural reflex and works like a charm. Now let's talk about what a good latch looks like. First off, your baby's mouth should be wide open, with more of the areola visible above their top lip and less below. Their lips should be flanged outwards, almost like a fish, and not tucked inwards. You'll also want to pay attention to your baby's chin and nose. The chin should be touching your breast, while the nose is free for easy breathing. If you're seeing these signs, congratulations. You've got a good latch. But what if it doesn't go as planned? Don't worry, it's not uncommon to face some hiccups. If you're experiencing pain during breastfeeding, or if your baby isn't gaining weight as expected, these could be signs of a poor latch. First, try adjusting your baby's position, or the way you're holding them. Different holds work for different moms and babies. You might also consider using a breastfeeding pillow for extra support. If you're still having trouble, don't hesitate to reach out for help. A lactation consultant can provide invaluable advice and hands-on help. Remember, every new skill takes practice, and breastfeeding is no exception. In the end, the most important thing is that both you and your baby are comfortable and relaxed. The breastfeeding journey is a unique bonding experience between you two, and a good latch is a significant part of that journey. A good latch is essential for effective breastfeeding. So take your time, be patient with yourself and your little one, and remember that you're doing great. While breastfeeding is a natural process, it's not without its challenges. Indeed, as natural as breastfeeding may seem, mothers often encounter a few hurdles along the way. But fear not, for every challenge, there's a solution waiting to be discovered. One of the most common challenges faced by new mothers is sore nipples. This can be quite uncomfortable and even discourage mothers from continuing with breastfeeding. This discomfort is typically caused by incorrect latching, so it's essential to get the latching process right. You can mitigate this by making sure the baby's mouth covers a large part of the areola below the nipple, and the baby's lips are flanged outwards. If the soreness persists, consider reaching out to a lactation consultant or your healthcare provider for assistance. Now let's talk about engorgement, another common challenge. This happens when your breasts are so full of milk that they become swollen and painful. In the first few days after childbirth, your body is still figuring out how much milk to produce. Sometimes it overestimates a bit. But don't worry, this is a temporary issue. To alleviate the discomfort, you can apply warm compresses before breastfeeding to help the milk flow, and cool compresses afterwards to reduce swelling. Gentle breast massages can also help relieve the pressure. Another concern that many new mothers have is the fear of low milk supply. It's crucial to know that the more you breastfeed, the more milk your body produces. It's a demand and supply system. If you're worried about your milk supply, try to nurse your baby frequently and make sure they're latching correctly. If you're still concerned, don't hesitate to consult your healthcare provider or a lactation consultant. They can provide reassurance and offer solutions if needed. There's also something called mastitis, which is an infection of the breast tissue causing painful swelling and redness. It's usually the result of a blocked milk duct that hasn't cleared. If you suspect you have mastitis, it's important to continue breastfeeding and seek medical attention. Your doctor may prescribe medication to clear the infection. And finally, let's not forget about the challenge of finding a comfortable breastfeeding position. This can be a trial and error process. You might find the cradle hold works best for you, or perhaps the football hold. The key is to find a position that allows your baby to latch properly and lets you feed without straining your back or arms. Before we wrap up this section, it's worth noting that while these challenges can seem daunting, they are not insurmountable. With patience, perseverance, and the right support, you can overcome them. And remember, it's perfectly okay to ask for help. Reach out to healthcare professionals, join a local support group, or connect with other breastfeeding mothers. Remember, every challenge has a solution. With time and practice, you'll soon become a breastfeeding pro. Keep going, you're doing an incredible job. Taking care of yourself is just as important as taking care of your baby. Becoming a parent, especially for the first time, can be a whirlwind of emotions and experiences. Amidst the excitement and joy, it's easy to forget that your well-being is just as crucial as your newborns. So let's talk about self-care for new mothers. Firstly, nutrition. It's not just about eating, but eating right. Your body has gone through a tremendous journey, and it needs the right fuel to recover and provide for your baby. Focus on a balanced diet rich in proteins, whole grains, fruits, and vegetables. Stay hydrated and don't forget those essential vitamins, especially if you're breastfeeding. Next, let's touch on rest. Yes, those midnight feeds and diaper changes can be exhausting, but remember, it's okay to ask for help. Delegate tasks where possible and catch up on sleep when your baby does. Rest is not a luxury, it's a necessity. And how about emotional well-being? It's okay to feel a mix of emotions: elation, exhaustion, anxiety, love. It's all part of the journey. Reach out to your support network, talk about your feelings, and don't hesitate to seek professional help if needed. Your emotional health directly affects your ability to care for your little one. Remember to take small moments for yourself too. A warm bath, a good book, a short walk. These small breaks can do wonders for your mental health. Lastly, understand that being a perfect parent is a myth. There will be days when things don't go as planned, and that's okay. What matters is that you're trying your best. Be kind to yourself, acknowledge your efforts, and celebrate your wins, no matter how small. In the end, self-care isn't selfish, it's essential. It's about being the best version of yourself, so you can be the best parent for your baby. Remember, a happy mom makes a happy baby. Breastfeeding your newborn for the first time can be a magical experience. As we've walked through this journey together, there's a lot we've covered, and it's important to remember these key points. We started with understanding breastfeeding, the beautiful bond it fosters between you and your baby, and how it provides essential nutrients for your newborn's growth and development. Remember, breastfeeding is a natural process, but it doesn't always come naturally. It's okay to need time to get the hang of it. Then, we moved on to preparing for breastfeeding. It's critical to create a comfortable environment for both you and your baby. A calm setting, a supportive nursing pillow, and a glass of water nearby can make a world of difference. And don't forget, skin-to-skin contact is a wonderful way to bond with your baby and stimulate milk production. The latching process is crucial to successful breastfeeding. A good latch means your baby can feed effectively and you can avoid discomfort. Every baby is different and it might take a bit of trial and error, but the signs of a good latch include seeing your baby's mouth wide open, their chin touching your breast, and hearing them swallow. We also discussed common challenges and solutions. It's normal to encounter issues like sore nipples, engorgement, or a baby who won't latch. But don't despair, there are solutions. Nipple creams, warm compresses, and the assistance of a lactation consultant can help overcome these hurdles. Remember, it's okay to ask for help. Finally, we touched on the importance of self-care. Breastfeeding can be physically demanding and emotionally draining. It's vital to take care of yourself by eating a balanced diet, staying hydrated, and resting when you can. You're not just a mom, you're a human being who needs care and rest too. As we wrap up, I want to emphasize the importance of patience. Breastfeeding is a journey, often with a steep learning curve, but it's also a beautiful bonding experience. It's okay if you don't get everything perfect the first time. What matters most is the love and care you're providing for your baby. And remember, you're not alone in this. There are support groups, lactation consultants, and healthcare professionals ready to help you navigate this journey. Reach out to them, lean on them. They exist to make your breastfeeding experience as smooth and enjoyable as possible. In conclusion, take these lessons to heart, but also listen to your instincts. You know your baby best. Trust yourself, and know that with every feeding, you're helping your baby grow stronger and healthier. Remember, you're doing a great job, and you're not alone in this journey.